Welcome to the Endo Kids podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsey Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care.
Hello again, and welcome to the Endo Kids podcast. My name is Dr. Lindsey Waldman. I am a pediatric endocrinologist, and today I am so excited to be joined by a pediatric gastroenterologist. Dr. Natalie Sikka works at Pediatric Specialists of Virginia, which is located in Northern Virginia. So, Dr. Natalie Sikka, welcome. Thank you so much for taking the time to talk with us today.
Well, thank you so much for having me.
I guess before we get started talking about how gastroenterology and endocrinology meet in pediatrics, tell me a little bit about yourself and how you got interested in pediatric gastroenterology.
So it's interesting. I think gastroenterology always interested me because I think it was a way for me to combine a lot of my interests, because there's still a lot of general pediatrics within gastroenterology, but you also have more chronic illnesses that we see. We see kids with Crohn's disease, ulcerative colitis, celiac disease, feeding difficulties. So it really, there's a wide spectrum. And so I enjoy that. And I enjoyed the fact that we do have continuity with our patients and with their families. And it also involves nutrition, which is something that I'm interested in. So I think it was a way for me to combine a lot of my interests. We also do procedures like upper endoscopies, colonoscopies. Some kids need liver biopsies, for example. So that aspect is also interesting. So it was a way for me to combine interests. And I think like a lot of folks, when they have really good mentors in the field, that also attracts them. And I was fortunate to have that during my training.
It's funny, when I was thinking about what I wanted to go into, it was either going to be gastroenterology or endocrinology. And a lot of the reason was because of the nutrition aspect. My background is in nutrition. And so I really was between the two. So I think we are very similar in that way.
It factors into so many specialties, and we wish there were even more time to talk about nutrition.
Absolutely. And I think we're going to hit on that today for sure. So that's definitely going to be part of our conversation. So why don't we start a little bit about just understanding growth? A lot of what I do surrounds growth. A lot of what you do surround growth. So thinking about the new picture, the big picture for that. So when parents think about quote unquote normal weight gain, what does that actually mean to you medically when you're looking at the child?
So I think the important thing with weight gain is you do want to realize that every child has their own growth curve, so to speak, and weight curve. So you go to the pediatrician or to the specialist, and of course in pediatrics, you get weighed and measured each time. And so you do want to make sure that your weight is tracking along your curve or that child's curve. Now, of course, there are some kids that are just going to be smaller. They are petite, but if they're tracking along their weight percentiles, that's okay. There are some kids that are going to be bigger. So I think it's when you see that there's a big change, either a rapid increase in weight or a rapid decrease in weight, or maybe a plateau in weight, because in pediatrics, kids should be gaining weight at least until they're late teens. So when we see any big changes, that's when we might need to start looking further. So I think every child is a little bit different. So that's why it's really important to know what their previous heights and weights have been.
And we certainly know, and we've talked about how genetics plays a big influence in height, right? I like to say if you come from a family of more petite people, it is likely you will be on the shorter side. And on the opposite spectrum, if you come from a family of taller people, it is likely the child will be taller. How does that play into when we think about weight?
So I think we certainly see some of that as well with weight. I think if you've got a family where there are thinner, slimmer people, that's okay if the child is on the slim side. You may have a family where, their constitution is a little stockier, so to speak. And that's okay too. It just depends on what their nutrition is like. You've got to delve into what their nutritional intake is like. Because again, even if you come from a smaller family, if, your nutritional intake is not adequate, then we have to look into that as far as why. And on the flip side, if you have somebody who's gaining weight rapidly, even if the rest of the family is larger, we still have to look into why are they gaining weight quickly. I would say definitely genetics plays a role, but I would also say we do want to look into what their pattern has been over time, also what their nutritional intake has been, because at the end of the day, we want to make sure their nutritional intake is adequate and that we're looking for what the pattern of weight gain is over time.
And when we are thinking about nutritional intake, and let's think about a child maybe where the concern is that they are not gaining enough weight. If a family comes to see you and that's the concern from the pediatrician, from the family, what are some of the first steps? What can a family expect when they see you for that concern?
So I think we're definitely going to want to know what the rate of weight gain has been, what their pattern has been. And if we're seeing that they're just not gaining weight the way we want them to, then we're first going to ask, what about their intake? Has that changed? What can you give us kind of a sample throughout the day of what does a typical day look like? What does breakfast look like? Or again, this all depends, of course, on the age of the child. What does a typical daily intake look like? And then we can at least try to figure out, all right, if they're not gaining weight the way we want them to, is it that they're not getting enough gas in the tank, so to speak? They just don't have enough calories in? Or is it that they've got enough caloric intake or nutritional intake? Because again, it's not all about calories. That's another part of the conversation. We don't want them to consume calories just for the sake of calories. They've got to be nutritional calories or nutritious calories. But if they are getting enough nutrition, or are they just not holding on to their nutrients? Or are they throwing them all up? Are they pooping it all out? Are they having diarrhea? Are they just not absorbing for some other reason? So that's part of it too, is to figure out where are there enough calories going in? And then if not, how can we help with that? And if there are enough calories going in, what's happening to them? And do we need to do other testing? Do we need to do blood work? Do we need to do tests of their stool to figure out if there's any evidence of malabsorption? So those are some places that we would probably start. So we do a lot of questioning initially to get a good history.
And when you are getting that history and getting that intake, if you're leaning towards there's not enough calories being taken in, how do you figure out if this is maybe normal, picky, or selective eating versus something a little bit more concerning? Are there any particular red flags that you look for in that sense?
So I think the first thing would be, and again, it's going to depend on age. Are they having trouble swallowing? Are they having any choking on their food, gagging on their food? Is this something that could be an anatomic issue or some sort of inflammation in the esophagus that is causing them to have trouble taking in enough? So that would be one thing to try to figure out. And then also, Are they, when they're eating, what's the amount that they're eating? Are they eating what we would consider an appropriate, age appropriate size meal? Are they getting full right away? Are they throwing up? Are they going to the bathroom right after they eat? Are they waking up in the middle of the night with any symptoms? Are we having stomach pain? Are we having vomiting? Are we having diarrhea? Are we constipated? So those are all things that kind of go into questions that we would ask.
And are there any tips that you give to kind of those families that are dealing with normal picky eating or selective eating? And again, I know it changes through the years, but maybe in those toddler, early childhood years that we've all been through.
Yeah. So it's difficult for sure because we know that kids are selective. A lot of kids are selective eaters, and parents, of course, want them to eat. And so some parents, in an effort to get them to eat, will give them what they want. However, you also have to be careful of what you're giving them because these are the years in which we're trying to promote healthful eating habits. And in pediatrics, we're all about preventive medicine. We want to prevent problems in the future. We don't want our kids to develop heart disease, liver disease, all sorts of inflammatory diseases that can be linked to poor dietary intakes. So it is tricky, but I would say that definitely encouraging a variety of nutritious foods. And that's hard because a lot of kids just don't want it. A lot of it does depend on the parents' eating habits too. I was just thinking about this with the patient I saw earlier today, which is we can encourage the kids to eat healthful foods, but it's got to be modeled by the parents too. So if the parents aren't eating healthful foods or fruits and vegetables are not available in the house, then it's hard for us to expect that the kids are going to then be eating those things. So if we can get buy-in from the families to model the behavior, then it's a question a lot of times of, all right, what do I do with the child? How do I get them to eat some of these nutritious foods? And oftentimes it's a balance between giving them the more preferred foods and also incorporating some of the more healthful, non-preferred foods that they want. But I do think, again, it's really important to think about what we're putting into them. We don't want to feed them calories just for the sake of calories, because I think now there is more attention being paid to processed foods and refined sugars and the fact that those are just not good in the long term. And we really have to do a better job of focusing on the fruits, the vegetables, the fibers, the lean proteins, the fish from the beginning.
Saying that as a parent, right? But not as a
Right.
doctor. How do you find that emotions, anxiety, all of that kind of plays into this mealtime struggle?
Oh, yeah, definitely. People talk about your gut as your second brain. We feel everything in our gut. And there's a big category of conditions called disorder of the gut-brain interaction. So if you think about the fact that you just have a ton of communications between the brain and the intestinal tract, if anything interrupts those communications, whether it's anxiety, whether it's certain types of foods, whether it's certain medication, the viral illness, whatever it is, people are going to get intestinal symptoms, whether it's abdominal pain, whether it's nausea, whether it's vomiting, constipation, diarrhea. That is probably one of the more common reasons that we see patients actually is because of these symptoms. There are definitely ways to help manage these symptoms, but most definitely emotions can certainly play a role.
And on that note, when you are trying to differentiate you think the patient is taking in enough calories, you went through that part, but now it's on to the symptom. They're having abdominal pain, and you're trying to figure out, what is this from?
Oftentimes, we will need to do some blood work to make sure, okay, we're not anemic, or we don't have celiac disease, for example, or we need to do some stool testing to make sure that there is no evidence of inflammation in the intestinal tract. We may need to do endoscopies and or colonoscopies to look at the lining of the intestinal tract to see if there is any inflammation that could be then contributing to the symptoms and lack of weight gain or lack of growth. Sometimes there are other X-ray studies or radiology studies that can be of help. So sometimes tests are needed. Sometimes they're not indicated. And a lot depends too on the family. A lot of families have a sense of what could potentially be the underlying issue. Some say, look, I really think it's anxiety that's at play. And when the child agrees, and then others say it's not anxiety and it is something else. So it's really, it can be challenging to differentiate what's at play. And sometimes often it is a stepwise process because you want to do testing where it's indicated. You also don't want to do unnecessary testing and then make anxiety worse because medical procedures are anxiety provoking. Doctor's visits are anxiety provoking. So it's obviously important to do testing where it's indicated. We also obviously try to do testing appropriately and think about what we're doing, not just order tests for the sake of testing.
I think that's really important because, like you said, going to doctor's visits are certainly anxiety producing for both the children and the parents, the whole family that gets involved in this. Moving on to maybe some more practical takeaways for parents, just thinking of common conditions that I'm sure you see all the time. The first one being constipation in children. I'm sure you hear about it and see it all the time. If there were any practical takeaways for a family that's dealing with constipation, what would they be?
So first, know that you're not alone. So this is probably one of the most common reasons that we see kids. So parents are not alone in dealing with this. It's very common. And well, a lot of times it has to do with fear. If the child has, especially in the toddler ages, the child has a painful bowel movement. In their minds, they say, why would I do this again? When they hold it in. And then when they finally do go, it's larger, it's harder, it's more painful. It creates a vicious cycle. And there's not much they can control, right? They can control what they put in their mouth, and then they can control when they pee and when they poop. So I would say, as far as advice, don't force anything. Don't force toilet training, for example. It's going to happen when it happens, but you don't want to force it because you don't want them to start holding it in and being afraid to go. If they do become constipated, then know that there are things that we can do. Some of them involve diet changes. Again, easier said than done. But we do have medications and supplements that can be used to make them more comfortable. So we can get it under control. And again, the diet is going to be helpful. So if kids are willing to try new things and parents are engaged in trying to get them to try new things, then that's also going to be helpful. But I guess what I would say is don't despair. We can definitely fix it. And sometimes there are other tests that we need to do if a child is chronically constipated. It's not always just diet related. There may be some blood tests that we need to do to rule out other things. There may be some X-ray studies. So again, this is where it's a process. And so in the initial visit may not tell us exactly what's happening. It may take a couple of visits to figure out what the right thing is, but we will get there.
Tell me your approach to sweets and junk food. Any practical tips for families that it seems to be a battle between the children and families about junk food?
Right. And it's everywhere, right? They're treats, they're at birthday parties, you go to people's houses, it's very tempting. I think that the key is to try to moderate what you're giving them. Of course, you don't necessarily want to deny them these things. And I would say some things are okay, but like with everything else, in moderation. Now, there are some families that do not want to give their child anything with refined sugars. That's okay. There are other families and they are fine using refined sugars. And again, no judgment one way or the other. We just try to combine it with as much helpful food as we can so that the sweets are they're not an everyday thing. Or if you're going to have dessert, maybe it's like a small piece of something. But again, if you set up a routine, kids really like structure. So if they know what to expect and they know that, okay, it's going to be this small piece of chocolate or something like that, then that's part of their routine. But if things are not consistent and some days they're allowed to splurge and other days they're not, and they don't know when it's coming, I think it's helpful to explain to them, again, age appropriately, of course. But again, the idea is that we're really promoting the healthful foods as well. And then the sweets and the junk food just should be minimized.
And when would you recommend a family seek out a pediatric GI like yourself?
Kids who have chronic abdominal pain that wakes them up in the middle of the night, for example, vomiting that's ongoing. I would say diarrhea, certainly blood in the stool, unexplained weight loss. Well, oftentimes the pediatricians will do blood work before they see us. And if they find that they're anemic, for example, or they do find other abnormalities in the blood work, those are reasons to come see us. If we are seeing a drop off in their weight percentiles over time, or we're seeing a drop off in their growth percentiles over time, those are also reasons. Sometimes they may not have symptoms, but if you look at their growth charts, you say, this doesn't quite make sense. And it does deserve further evaluation.
Perfect. And as we are wrapping up soon, are there any myths out there that you hear or that families come to that you want to bust as we're wrapping up?
Oh, let's see. A myth. What do families come in? That's a good question. I have to think more about it. I think people get information from a lot of sources these days, and some of it is valid and some isn't. And I think having an open discussion and just keeping the lines of communication open is very important. As physicians, we don't know everything. Medicine is not an exact science, and every patient is different. The communication is very important. And I think being willing to agree and disagree is part of the process. Someone may come in with a set of beliefs. I may not agree with them. It's not, but I need to at least explain my thought process. And vice versa. I may make recommendations. People may not agree with what I have to say, but then they explain their thought process. And the idea is that we can come to some sort of a mutually agreed upon decision, because at the end of the day, we both want what's right for the child. We're promoting the health of the child and trying to optimize their growth and development. So that's what the most important thing is.
And so, Dr. Sikka, if there's someone out there that is looking to make an appointment with you, where should they look?
Pediatric Specialists of Virginia is our group, and we're a partnership between Inova Fairfax or Inova Children and Children's National. We do have a couple of different officers, our main officers in Fairfax. We also have one in Ashburn, and we're happy to see patients. So if y'all are welcome to call the main number at I believe it's 703-876-2788, or look at the website, or certainly if they need a referral from their pediatrician, I'm sure the pediatrician can provide that as well.
Perfect. I want to thank you again for taking the time to talk with us. Thank you so much. This was super helpful. I'm sure families out there will enjoy it as well. And thank you all for tuning in again to the EndoKids podcast. Please make sure to like and subscribe, and we will talk with you again soon. Thank you so much for joining us on the EndoKids podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.